Hi everyone. Hope you had a wonderful week and have another great week this week as we wrap things up. We're in week 9 and really week 10 is just saying goodbye and getting those final projects in. So we are pretty much at the end of the road. Week 9 is a great time to kind of wrap everything up and really talk about how everything that we've learned, all of these different tools and everything, how it's actually been integrated into therapy and different types of therapy. One of the misconceptions is that positive psychology is actually a therapy in itself, which isn't really true. What it is it has many great tools that can be integrated with other types of therapy. So we're going to talk a little bit about those and a few other things. As I was doing the research for this slide presentation, as you can see it's all pictures, so this one's really just going to be an audio presentation because I found a really wonderful article in the Harvard Crimson that really talks about everything that your chapter talks about, but just is a really nice condensing of the material. So this will be just a really good supplement for you. Before we go on, the one thing that I want to remind all of you is that for the class final project, there is a tab in the course room where you can go and you can see all of the different projects that you can do for your final project. And now is kind of a good time to be thinking about that because I know a lot of you are going to be inundated with finals and other projects. And this too will be due on the last day of the course. And just to kind of think about it and get started on what it is that you want to do. Okay, so let's talk a little bit about positive psychology and psychotherapy. So first off, our first objective was talking about learning the approaches of psychotherapy based on positive psychology. So let's look at positive psychology in practice. Positive psychology is something dismissed by many people as just happy talk, but practitioners say that there are techniques provide a much needed balance in psychiatry, traditional focus on the psychic pain and pathology. So in other words, what they're saying is that positive psychology is really acting as a balance to a lot of the issues that are brought when we know that we have an individual who is seeking out counseling. So that's just kind of an important foundation. The term positive psychology is a broad one, encompassing a variety of techniques that encourage people to identify and further develop their own positive emotions, experiences, and character traits. In many ways, positive psychology builds on key tenets of the humanistic psychology. So if we go back to our counseling psychology, if you guys have already taken that, what we're talking about here is Carl Rogers' client-centered therapy. For example, it was based on the theory that people could improve their lives by expressing their authentic selves. And Abraham Maslow identifies traits of self-actualization of people that are similar to the character strengths identified and used in some of the positive psychology interventions. So although initially developed as a way to advance well-being and optimal functioning in healthy people, positive psychology techniques are now being promoted and complement to more traditional forms of therapy. For example, at the University of Pennsylvania, psychologist Martin Seligman was a well-known advocate of positive psychology, has described its core philosophy as a build what's strong approach that can augment the fix what's wrong approach of the more traditional psychotherapies. So if you remember back to our first couple of chapters, we talked about looking at the medical model and then looking at the wellness model. And so really this is what a lot of these positive tools that you all have learned is starting to do in psychotherapy, is giving these people the tools to realize that they have the strengths and that when they do come in, it's not always all about what's wrong, that there are many things that people have in their strengths that they can use to help get them through, and even if they're strong, it can help them be even stronger. So another pioneer in the field at Harvard was psychiatrist George Vaillant. So, and he sees positive psychology as a way to encourage patients to focus on positive emotions and build strength, supplementing psychotherapy that focuses on negative emotions like anger and sorrow. In a talk about positive psychology, Dr. Valiant cited the examples of a standard psychiatry textbook used by psychiatrists and clinical psychologists. The textbook, he says, contains roughly 1 million lines of text, with thousands of lines devoted to anxiety and depression, and hundreds discussing terror, shame, guilt, anger, and fear. But only 5 lines in the textbook discuss hope, and only mention joy, and only 1 mention of joy, and not a single line mentioned about compassion and love. So this is, again, going back to what we were talking about of the lopsided pendulum in the beginning, and that we want to try to, swing the pendulum to an even keel. We don't want to say that there aren't any negative issues and not deal with those. We want to be able to deal with those, but we also want to draw out the strengths in a person too. So to counter the traditional focus of pathology, Seligman and other psychologists, such as Christopher Peterson, have formalized the tenets of positive psychology in a book called The Character Strengths. And you all got a chance to realize your character strengths too. So and I hope that you all found that beneficial of knowing that your character strengths are unique to you. So just as the DSM classifies a range of psychiatric disorders, the Character Strengths provides details and classifications for various strengths that enable people to thrive. The book identifies 24 character strengths like curiosity, zest, organized according to 6 overarching virtues such as wisdom and courage. A number of different counseling and coaching strategies rely on aspects of positive psychology. Although it's impossible to review all of them in a single article, a few examples can help provide a taste of how they might complement the more traditional ways of therapy. So now we're going to go on and we're going to talk a little bit about the well-being in therapy. So we're going to be able to describe the features associated with positive interventions. So as its name implies, well-being therapy tries to promote recovery from depression and other affective disorders by having a patient focus on and promote the positive, as well as alleviating negative aspects of life. Developed by Giovanni Fava at the University of Bologna in Italy, well-being therapy is based in large on part of the work of the psychologist of Carol Rife and her multidimensional model of subjective well-being. Rife's model consists of 6 tenets: mastery of the environment, personal growth, purpose in life, autonomy, self-acceptance, and positive relationships. So this really sounds a lot like many of the things that we've talked about over the past 9 weeks. And so really what you guys have learned, and each of the tools that you've either learned to use or that we've explored, these are aspects now that can be integrated into therapy. So for a lot of you who are going on to be counselors or teachers or caregivers in any way, that you can see the benefit of that they can also be therapeutic, not just applying them to yourself, but also by helping others too. So in practical terms, well-being therapy is much like cognitive behavior therapy. A patient keeps a journal and keeps track of and recognizes the positive events that occur each day. Next, the patient starts recognizing the negative thoughts and beliefs that distract or disrupt positive events. The ultimate goal is to challenge and eventually change the negative ways of thinking to enable the positive events to have more of an impact on a patient's life. So there is probably no other area that negativity has impacted a person than when we talk about post-traumatic stress. So we all know that many of you have husbands, wives, friends, or are in the military, and so we know that the impact of post-traumatic stress disorder has really become quite an issue in many of the military services. So I want to talk a little bit about what we're going to talk about next, which is the post-traumatic growth. And I want to caveat this a little bit with an understanding. Post-traumatic growth, when we see this, in some ways you kind of view it as from end result and then looking back. Because we know post-traumatic growth, what happens is that after the traumatic event, that the person is able to reflect and become the benefit finder instead of the fault finder, and they're able to actually find a positive aspect of a tragedy. And a lot of times when you look at this, some people might say, you know, well, people just don't get over things real quickly, and what if they don't? Does that mean that they don't have growth? I think when we think about the traumatic events, the one thing that we have to really keep in mind is that just like forgiveness and all those other things that we talked about, it's not oh, this is going to happen in a week or this is going to happen in 2 weeks. And, you know, sometimes the positive growth takes many different methods or different types of therapy for one individual. It is not a one-size-fits-all. So when we talk about growth, we're talking about seeing the positive changes in a person who has been able to experience and process through an experience and come out on the other side and find benefits. There are a lot of people that take a very long time to process through, and as we know that we've lost many brothers and sisters to suicide after they've come home from a deployment, and so we know that you know, not always does this process carry through to positive growth where the person comes out okay on the other side. However, in looking at positive growth in post-traumatic is that we look at what has actually gone on to pull that individual through. Is it their building of their resilience? Is it a connection to other people? And so by understanding positive growth, what we really want to look at is what's involved in that, so that when we do implement it or integrate it into therapy, that we can understand what some of the positive attributes can be. So let's talk a little bit about what positive post-traumatic growth is. So post-traumatic growth has been researched in hugely diverse settings of traumatic events, from divorce to death to natural disasters and to terrorist attacks. The literature on post-traumatic growth shows that even though the causes of post-traumatic growth are vast, the benefits reported fall into 3 categories. These are feeling stronger and finding hidden abilities and strengths. The changes in the person's self-concepts and gives them confidence to face new challenges. For example, that I can survive I can survive anything if I can survive this. 2, good relationships are strengthened, which is reflected in how people often speak of finding out who their true friends are after they have experienced a trauma. And 3, priorities and philosophies concerning the present day and other people are altered. Living for the moment, and really prioritizing your loved ones. So these seem to be a great deal of consistency in the literature regarding these categories. The growth or the benefits and the victims of the traumas report this. Although the wording used to describe these categories sometimes differ among studies, the underlying principles remain the same. So in one study, it reported that mothers of ill children described 3 benefits. And one is emotional growth, a closer to their family relationships, and a better perspective on life. Other studies have not reported all of these categories. However, another study found that heart attack victims only reported greater self-insight and positively altered values of priorities. The literature on post-traumatic growth seems to have reached a stage of agreeing concern and benefits that post-traumatic growth actually refers to. However, future studies should not dismiss the possibility that other benefits can be found. So benefits that are not as prominent, let me get this. are not as prominent, such as an increase in nostalgia may have been overlooked and as a result not measured. So there was another one I wanted to talk about here for post-traumatic growth, which was coined in 1995 by Richard Tedeschi and Lawrence Calhoun. So, and they're from North Carolina, the University of North Carolina, that they've been working on bereaved parents for about a decade. Richard says they had been through the most shattering kind of loss imaginable. I observed how much they had helped each other and how compassionate they were towards other parents who had lost a child. How in the midst of their own grief, they often wanted to do something about changing circumstances that had led their child to their child's death to prevent other families from suffering this kind of loss that they were experiencing. These were remarkable and grounded people who were clearly about their priorities in life. Nonetheless, parents, Richard stressed, believed that their child's death was not a good thing. None of the parents would have said that processing through it was a positive thing, even though they had found positive aspects from the outcomes. They would have given up all of their newfound activism and insights in altruism. They reordered their senses and what they really mattered in life to have their child back. The process of growth does not eliminate the pain or loss of tragedy, Lawrence says. We don't use words like healing, recovery, or closure. But out of loss, there is often gain, he says. And in a way, that can be deeply profound. A staggering crisis can often change people for the better. So that's a little bit about post-traumatic growth and kind of the importance of how positive psychology fits into that. So the next one we're going to talk about is understanding factors associated with the strength-based approach. And so integrating positive psychology in practice. So psychologist Carol Kaufman, director of the Coaching Positive Psychology Initiative at Harvard, discussed 4 techniques of integrating the principles of positive psychology into more traditional types of individual or group therapy. And again, I want you all to remember that, you know, a lot of these things and these tools, it doesn't have to be a therapeutic or a psychoanalytical arena to actually integrate these tools. It can be something at home. You might pick up something you want to do with your kids. It could be at school if you guys are care providers, at your work of just dealing with other people. So reverse the focus from negative to positive. Most people tend to dwell on the negative events or emotions and ignore the positive ones. And therapy can encourage this, which, you know, is kind of exactly what we don't want to do in therapy. We don't want to keep exacerbating the problem. But a lot of times by constantly talking about the negatives, then that's really what's all that's on that person's mind. So we want to change those views. So one way to reverse the focus is to use techniques aimed at shifting attention to more positive aspects of life. For example, take a mental spotlight each night and scan over the events of the day, thinking about what went right. Another tip is to compile I did it list instead of only writing down what needs to be done. Develop a language of strength. Therapists and patients often talk about pain, conflict, and anger. Although these are aspects of life, it may be harder for people to talk about or even identify more positive qualities and personal strengths. And you all did a really great list last week of looking at, when I asked you what are things that you all do right, and there were some really great things that came out of it. I know when I first did that, it seemed a little bit awkward, like I was tooting my own horn or bragging, but, you know, really sometimes we need to be able to do that because we don't give ourselves enough credit and we don't give ourselves enough praise. So Kaufman and other positive psychology practitioners often use strength coaching while advising patients. Just as an athlete exercises certain muscles to become stronger, the theory is that people who use their strengths regularly will function better in life. To boost mental facility, Kaufman recommended that people identify one top strength and then use it at least once a day. So another one is to balance the positive and negative. It's also important for people to identify and foster the positive for themselves and others in order to provide a balance to the negative. For example, business executives may praise with criticism and then evaluate employees, and then criticism when evaluating an employee's nurture to their growth. So in other words, balancing the positive and negatives even in a work environment. So build strategies that foster hope. Finding ways to foster hope is in someone may increase that person's ability to deal with adversity and to overcome any challenges. One way to cultivate hope is to reduce the scope of the problem, perhaps by breaking it down into components that can be tackled one at a time. Another way is to identify skills of coping mechanisms that would enable a person to overcome a particular challenge and then provide a way to build them. Another topic is positive psychotherapy.